Well, good morning. Great to be here with Dr. Scott Atlas from the White House Coronavirus Task Force. Of course, we have our Commissioner of Education, Richard Corcoran, and our Surgeon General, Scott Rivkees. We also have Michelle Gregory, parent to two local elementary school students, so we thank you. And then Jana Saylor, Board Chair, Tallahassee class. Thank you for coming. An update on coronavirus in the state of Florida. Fortunately, the number of COVID-positive patients that are currently hospitalized is down about 60% since our July peak. The number of COVID-positive patients in the ICU is down about 52% since the July peak. The number of COVID-positive patients that are currently in Florida hospitals represents about 6% of all licensed beds in the state of Florida. The number of hospital admissions for COVID yesterday, which is our most recent numbers, were the lowest number of hospital admissions since June 15th. Florida today will report 1,950 new cases, the lowest number since June 14th. Now, how many of these positive tests actually identify live virus or contagiousness is, of course, not known, but I would imagine many of them don't. Antibody testing at Florida's drive-through sites has continued to register at between 20 and 25%. And, of course, as those numbers have increased, the diagnostic positive percentage has fallen to the 5 to 6% range, and that is also going to be in today's report. We currently have 27% of hospital beds empty in the state of Florida. 24% of ICU beds are empty in the state of Florida, and emergency department visits for COVID-like illness have returned to the levels seen during the first half of June, which is perhaps the best leading indicator about where the epidemic is going. And so we appreciate having Dr. Atlas here. I know, Dr. Atlas, you and I have talked along the way, and we appreciate you always offering counsel for us here in Florida. But as we went into this, we really focused on three main priorities. One is protecting our most vulnerable, and that, of course, the most vulnerable are our residents of long-term care facilities. Very early, we required and sent PPE to all. We have over 4,000 facilities, so we sent, I think, over 10 million masks, and we sent millions of gloves and face shields and all these other important pieces of PPE. We did prohibit visitation very early to try to limit the spread into the facility, although we believe we have a safe way to move forward on that, and we'll be having an announcement on that soon. We've done testing of residents and staff, and we test all the staff biweekly, which is, we got about 200,000 people working in these facilities, so it's a big logistical effort. And then we were the first state in the country to establish COVID-only nursing facilities. So if you have somebody that is symptomatic or even just test positive, they can be transferred to a COVID-only facility, which will limit the spread to the other residents. That's also something that if they're in a hospital, we barred hospitals discharging COVID-positive patients back into nursing homes early in the epidemic. But if a hospital has somebody who is stable, they have a safe place to discharge them in these COVID-only facilities. And then, of course, our non-LTC senior citizens, the behavior changes and the caution that they exercised was something that we stressed, and I think that they have responded very well. We also, number two, wanted to make sure we had adequate hospital capacity and that our medical professionals had what they need. So in terms of PPE, we were overflowing with PPE when we came in mid to late June. We had a need in some areas for personnel. The summer is the low season in certain parts of Florida for hospital, and the staffing reflects that. So we had personnel dispatched on a needed basis to different parts of the state, and although we never reached capacity or really came significantly close on a statewide basis, little pockets that needed the help, we were able to do that. Of course, the hospitals were able to use our COVID-only long-term care facilities, but one of the things we did, we kept elective procedures in. There was a recommendation that pretty much every state implemented a ban on elective procedures at the end of March. Ours went till May 1st. The fact of the matter is that was a bad policy. We did not want to repeat it. So we told the hospitals, you make these decisions as you see some pressure, then you know how to dial back. So we ended up having some, like a Jackson and Miami-Dade, which was our most trafficked area. They dialed it back. But there were others, some of our major health systems throughout Central Florida, Southwest Florida, they never stopped electives. They were able to figure out where the demand was, and those electives are important for a lot of people's health. And so we wanted to approach it knowing that supporting our hospital capacity meant helping them deal with COVID, but also, as I said, COVID is only a fraction of who's in the hospital. We wanted to make sure that those other Floridians would still have access to the care they need. And then number three, we kept it as a key principle to keep our society functioning. And in the height of this, our most difficult month for coronavirus in July, we added 75,000 private sector jobs. If you look, Walt Disney World actually reopened right as the infections were peaking, and since Disney's been open, they've gone down steadily. We've had gyms, beaches, restaurants, hotels, theme park, youth activities, professional sports, all open and operating. And I think that we've seen now through examples in the U.S. and the rest of the world, that having a functioning society is very important in fighting an epidemic. And to put society on its knees is kind of cutting off your nose to spite your face. And so the schools, I think, are an important part of that. And our view on the schools was every parent in Florida should have an option about whether they have their kid for in-person instruction or whether they remain in distance learning. And so now, I think Richard can talk for sure, but I think including all our special districts, as of today, we'll have about 75 of them that'll have be offering in-person instruction. As parents have been given the option, a lot of them have enthusiastically embraced it. And then what we found is, as the schools have gone, more and more parents then decide, hey, I want to have that option for in person. And so it's a very important part for our youth. They were in distance learning from mid-March until the end of the school year. Now, they were doing a lot over the summer with youth activities, but to force them distance learning when the parents don't believe that's the best option for them is important. And of course, I'd say almost all private and charter schools are offering at least some measure of in-person, wouldn't you say? So this is an important part of making sure we're empowering parents. And I know you'll be able to talk about some of the stuff from the medical perspective, but this was, as we learn more about this virus, it does not act with young people the way influenza does, both in terms of them being vectors, and fortunately, it's less dangerous than influenza. And so I think we've understood that, and we've tried to follow those evidence-based principles going forward. We also have universities. We had some universities like Embry-Riddle that have been operating since the summer, and then our state universities are operating, and we think that that's important as well. I was a big proponent of making sure that we had football season, not only for all sports for the high school, but make sure we have football season here in the state of Florida for our universities, and it looks like that's going to go forward, which is a really good thing. So we appreciate you being here. I know that the administration, every time we've asked for support, has been there for us. If you look at early on some of the supplies and the logistical hurdles that everyone was trying to navigate, and then even most recently, the Trump administration sent over $125 million to long-term care facilities in the state of Florida for testing, for PPE, for whatever they need to be able to protect the most vulnerable. So that was a very generous amount of money, and I think targeted at exactly the area where a lot of our efforts should be. So we appreciate it. We've had the Vice President, we've had the President, we've had Dr. Birx, we've had so many people, Alex Azar, we've had Steve Hahn, we've had so many people from the task force helping us and coming down here. And so we're happy to welcome you and really appreciate all you're doing. So I'll turn it over to you.
Oh, thank you, Governor. It's a great honor to be here with Governor DeSantis and the people of Florida. And yes, I want to really, the governor is one of the first, if not the first, governor to understand that the strategy overall is really prioritizing who's going to be vulnerable here. So like you said, and like the president's policy has articulated in really direct concert with yours, the policies really have to be, number one, focused on protecting the high-risk people, the vulnerable, particularly the elderly and those in nursing homes. Two, making sure we can prevent hospital overcrowding, and you have very good strategies to do that. And 3, of course, opening society, and meaning opening schools, opening the rest of society, because a prolonged lockdown is extraordinarily harmful. And in the ways that it's being done here, I think are really exemplary. And again, the President agrees with this, that the goal is to open schools in person. And everything we can do to get that done is great. Of course, it's a local jurisdiction matter with parents and local school districts. And if there are options for parents that don't want to do that, or that are high risk in their homes, or the teachers are high risk, have some kind of option to be virtual, and I think that's being done very well. As I hear this morning, parents are opting overwhelmingly for in-person, meaning 75% of parents want in-person in Florida, it sounds like, but the rest have the option of doing virtual. I do want to highlight a few things, because this state is a great example of the partnership between President Trump and the administration in the White House and the state and Governor DeSantis and the private sector in making sure that everything was available that was needed. I mean, I won't go through all these numbers, but millions of N95 masks, surgical and procedural masks, all personal protective equipment done through private sector, state, and federal collaboration. I think that's a great way to approach things. The federal government has supported community-based testing in Florida with physical materials, but also particularly 446 of the certified nursing homes, Medicare, Medicaid certified, are receiving now federally supported point-of-care COVID testing. And this is a big focus of the President's really strategic point about protecting the vulnerable, not just in the nursing homes, but in senior centers, in assisted care, in non-residential senior situations, where we're going to have, in mid-September, all 14,500 certified nursing homes have point-of-care testing, every one of them. That's an unprecedented focus. We are starting liaisons with hospitals and nursing homes to provide better infection control, because nursing homes are not really used to that compared to hospitals. We're going to have surge testing by CDC strike teams when necessary, if there is an outbreak in a nursing home, and a lot of point-of-care testing in these senior centers, et cetera. So there's a big focus on this, and that is the focus. The purpose of all of this testing and everything, I think, as you can see from the new CDC guideline that was published this past week, is really to protect the vulnerable. That's the point of policy here, and keep everything open safely. And I think that's what America needs, and that's what America wants. And of course, lastly, there's been a lot of money, of course, helped by the federal government, and of course that means taxpayers. $8.3 billion to the state from the CARES Act, $157 million targeted to the tribal governments of Florida, which I think is very important. $32 billion in small business loans, and $18 billion in economic impact payments to the hardworking taxpayers of Florida. So it's a great partnership here, and we feel very comfortable with the policy of Governor DeSantis, because it's exactly right on target, and I really want to thank you for having me.
Great. Richard?
Thank you, Governor. I'd echo some of what you guys have said to start off. First, Governor, you know, we don't say it enough, I don't think, the just tremendous job that you've done. If you look at where we are and what it's allowed our schools to do and how we've been able to open, you know, if you look at any of the metrics out there, I just saw this morning our transmission rate is now the 7th best in the entire nation. Our cases are and positives are dropping. All of that's allowed us to open up our schools. You've done a fantastic job, and we thank you for that. And also to the administration, when you guys are up there beating the streets with the President, yourself, and Secretary DeVos saying, you know, open up bricks and mortar face-to-face instruction, it's an encouragement for all of us to be able to come down here and execute, especially with all the data-driven expertise you've provided to us, so thank you for that. But I think what's clear is that what we found out, I think, and of course I'm Commissioner of Education, so I would likely say this, but I think our K-12 system in many ways is the backbone of our society. And if it's a tremendously well-functioning K-12 system, pretty much everything else is functioning well. And so here we are, thanks to your work, Governor, we've opened up schools, 75 districts, that's our 67 counties, our lab schools, the Florida School of Deaf and Blind, and the virtual school, all open today. In fact, in Leon County was the first day of face-to-face instruction for Leon County, and all morning long my office has been getting calls or messages thanking so much for having that opportunity to have that face-to-face instruction. But there's also parents who are choosing distance, and that's the whole point of what the governor laid out was parental choice works, and we know that we can provide that education, whether it's face-to-face or whether it's distance learning. We can provide it for those parents who want that choice, and they're going to have good outcomes, and we can do it in a safe manner. And that's what we're doing. And you're seeing, we've said it all along, there's going to be cases. We're dealing with those and it's a de minimis amount, less than 1% of 1%, and we're keeping the schools open, we're keeping the instruction going, and we're having great outcomes. And that's going to lead us to a fantastic year. But I think, giving the districts, which have been our partners, not one district, one superintendent, one school board, they're all with us on giving those opportunities because they know that the best thing for students, more than anything else, to have that world-class teacher standing in front of those kids, imparting wisdom and knowledge, and then having those peer groups interact. And as we know, this morning we just had another great decision for parents, a great decision for students, a great decision for teachers, where the first TCA basically said, in looking preliminarily at what we've done, we have a high, substantial likelihood of succeeding on the merits, and was in an absolute rebuke of the trial court trying to take away that right from parents and students. And so I think we're going in a great direction. Today is the first day where we can literally say we're fully open. It's the last week where our districts are opening, and even our districts that were phase one have opened today for those children that are most vulnerable and most at need. And so that's just fantastic news, Governor, and I think we're going to have great results.
Great. Well, thanks for all your hard work. Okay, Michelle, the floor is yours.
Yes, well, thank you, Governor. I just wanted to say, I will tell you, I can't speak highly enough to giving parents the option. And my children personally are going back to brick and mortar. But I will tell you, we have many friends and associates that are choosing virtual simply because that is the best choice and makes sense for their family. So I will tell you, Governor, thank you for allowing us to have that choice. And overwhelmingly, I will agree, I live in Leon County, and everyone is very happy to have schools either virtually or in person back open. So I just want to tell you thank you.
Can you tell a little bit about, how many kids do you have, what ages, and what schools?
I have a 10-year-old and a 6-year-old. And I will tell you, I have never seen children get dressed faster in my life or move quicker than they were to go back to brick and mortar school. Again, that's a choice that works well for our family, but we were given the choice, so thank you, Governor.
Yeah, well, we're glad you have the choice. It's interesting, and I know Richard's talked to a lot of the superintendents. The common theme I would hear from them is, this was the best or one of the best first days of school that they've had. And these are people that have been in it for 20, 25, 30 years. And so I think the kids, just being able to have that environment again and return to a more normal schedule, I think is really significant, and obviously the educational opportunities. Okay, we have our Surgeon General, Scott Rivkees.
Yeah, thank you, Governor. Also want to thank Dr. Atlas for visiting with us. It's very important, and the other members of this panel. Secretary Corcoran, working together with you has really been tremendous for the children in the state. So, in the pediatric community, we absolutely recognize the importance of face-to-face education. And with the Department of Health, we've been working for months to make sure that when children resume face-to-face education, that this is done safely. Our county health departments have been working with the local schools to provide important guidance that is needed. We've been focusing on what mitigation measures are. We actually provided 10 million masks that can be used in local school districts. We have regular calls with school nurses and with other designated school health individuals. We have made testing of students a priority. So if a student or a teacher or somebody in school needs to be tested, with our county health departments and our state laboratories, we'll get that child tested that day. If a student would happen to, or a staff member would happen to test positive, Each of our county health departments, through our contact tracing programs, will be able to identify what risks of exposures are to other individuals. And we are very carefully monitoring the situation as more than 1 million students resume face-to-face learning. There have been a couple lessons learned that we've seen so far, which I wish to emphasize. One of the most important mitigation measures is for individuals. If you are sick, don't go to school. This has to apply whether you're a teacher or whether you're a student. Fever, cough, shortness of breath, change in smell, change in taste, sore throat. If you feel sick at all, please don't go to school. Contact your healthcare provider and get tested. The other important lesson is if you have a pending test for COVID-19 or somebody in your household has COVID-19, again, please don't return to school unless you have been medically cleared. So this is one of the things that we're carefully monitoring, and again, the Department of Health is playing a very important role in making sure that children will be able to return to school safely. Thank you.
Great. And yeah, I mean, we talk about all these different things over the past many months, but really the most basic is if you're sick, then stay home. And the good news about all the stuff we've done in virtual is that if a parent has a child who's under the weather, they can stay home, do the virtual, and really not fall far behind. Whereas, look, in normal situation, I get it. When you're not feeling well, you don't want to not go to school if you're going to fall behind, and so that's a natural impulse to want to do it. Well, we used to not really have that option. Now, a lot of these schools, you're going to be able to just dial it up and have it there for you, and you're not going to necessarily have this huge gap that would develop over the period of illness. And so I think that's something that's important. But it also, just in terms of the instructors, just understanding that applies to them in particular. Okay, go ahead.
Sure. Hello, everyone. My name is Jana Saylor, and I am one of the co-founders and the board chair of Tallahassee Classical School, which is a brand new charter school that opened its doors for the very first time today in the middle of a pandemic. And we have been working hard to get everything ready for our students, not just to open our doors for the first time, but to do that safely. And we have followed the guidelines. We are using face shields in our school. We have written our COVID opening plan. We have a health team in place to make decisions should we need to consider closing a classroom. And I'm also a mother of 4 children, and 3 of them got back to school today for the first time. They're going brick and mortar, and my youngest of those 3 is starting kindergarten for the first time today.
Great, thank you. Dr. Atlas, can you so when we talk about schools, either K-12 or a lot of these universities are just doing blanket testing. Mm-hmm. CDC recommends testing people that have symptoms by and large. If you're asymptomatic, unless you're part of kind of a vulnerable population, to not necessarily just have community asymptomatic testing. Can you talk about why that's the policy, and then how does that relate to different types of situations in both the university and K through 12 setting?
Sure. And that's really a fundamental point and really critical to understand on the new CDC guideline, which is that the purpose of testing is to protect the vulnerable. That's the purpose. The purpose of testing is not to document or minimize any kind of asymptomatic spread among very low-risk individuals. It's all about protecting the vulnerable. And so when you have a testing strategy, that's the point. The CDC guideline actually increases testing. It does not decrease testing, but it increases testing in a very smart way. Now that we have this massive testing apparatus that the President, Vice President, Admiral Giroir and the task force have set up, we're going to use it even better to save more lives. When you start a program of testing simply to detect positive cases among asymptomatic low-risk groups, there is really the outcome from that is to close the schools. The goal of testing is not to close things. The goal of testing is to protect the vulnerable, and while we open schools and open the economy. Now, in terms of low-risk groups, in children, it's very well documented, it is incontrovertible that there is extremely low risk to children from this illness. Not only low risk, but lower risk than seasonal influenza for both hospitalization and death. This is according to CDC data. And so we can't deny that, we can't panic, there's no place for fear in public policy. The children are not at any significant risk, although there are exceptions, but the exceptions, of course, exist in every medical illness. If you're a doctor, you understand that. They do not overwhelm the rest of the evidence. When you start, so in the schools, when you have testing of asymptomatic people and there are positives, you end up having this term called a school outbreak. But it's really just an outbreak of asymptomatic positive test results. That's not the same thing. So the key thing here in K through 12 schools really are to do the recommended mitigations, and that includes reducing indoor size groups, simple things like keeping windows open, holding activities outdoors if you can. Of course we want to do that because we want to protect the high-risk people in the school. Because we want to protect the high-risk teachers. We want to protect the high-risk students if there are some. We want to protect the high-risk staff. When you talk about universities and colleges, this is very important to understand. This idea that you will test widely among college students who are extremely low risk. We're talking about 99.8% of deaths are in people over 24. And only, so the student population is extremely low risk, as well as the staff of colleges really are low risk. Only 13% of college faculty are over 65. So it's not a high-risk group. There are high-risk people. We need to use mitigation. We need to use distancing from the high-risk people. But for college students to be tested that are asymptomatic, and then what do you do then? Well, if you close colleges, you're sending low-risk, asymptomatic people into a high-risk environment by sending them home where their older parents are or into the community. That's simply antithetical to the logic of the whole process here. College students need to stay in their low-risk environment, and when they're sick, they should isolate. And it's sort of a common sense strategy. You don't have to be a scientist to understand that. If you're sick, you really have to be isolated and stay home. And note this to your roommates, note this to the student health service. Be very, very cautious about this because these schools have cases brought in by the adults who are usually symptomatic. We have to make sure everyone is aware of the most obvious thing. When you're sick, stay home, wash your hands, do these social distancing things among high-risk people, but generally widespread testing is simply really unnecessary of asymptomatic people, and what I'm saying is consistent with the CDC guideline that just came out this week.
So I guess the thing that I've noticed, I mean, we obviously didn't have a lot of testing in February in the country, then we really ramped it up. Now we have this massive apparatus. But if you look at the PCR testing, CDC has said that you can test positive for up to 12 weeks. So it's identifying just the part of some RNA or whatever, dead virus. And then there was a report over the weekend saying that I think they had looked at like Massachusetts, New York, Nevada, the positive tests, and 90% of those didn't have enough virus to transmit to anybody. Mm-hmm. And so I guess the issue that I think it raises for me is, okay, we're doing this, testing a lot of healthy people, then these people, we can't tell if they have infectious virus. We can't even tell if the virus is live. They may have been infected 2 months ago. And yet, if they have a positive test with nothing else, they are isolating potentially for 2 weeks. So you're taking people who do not represent, and it seems like potentially even 90% of the time, taking them out of society, putting their life on hold, whether they're in a job, whether they're in school, whatever, all because of this one test of somebody who was asymptomatic. And I guess I think the CDC recognizes that with the guidance on testing, but then how does that impact isolation? Because if you're isolating somebody that cannot transmit the virus, that's a harm to take somebody out of society. We do that reluctantly because we don't want them to spread it. but it doesn't seem like this PCR test is a very good proxy for us to know whether someone's actually infectious.
Right, and that's a very good point, and some of the stuff is a little bit esoteric, but the reality includes these following things. PCR is an extraordinarily sensitive way to test for something, and it's very true that someone who has caught the infection or is virus positive can remain that for weeks to months. And so, in fact, the CDC stopped recommending that a negative test is necessary to discharge from a hospital because they recognize this. So we don't do that. In fact, when you're symptomatic, the recommendation is 10 days of quarantine or isolation, and then you're finished. You don't get another test. There is no reason to document a negative test. That's true. The other part is that it does point to the concept that, we have to recognize the harms of removing someone from society of a so-called prolonged lockdown. They are extraordinary, and the role of public policy is not just to eliminate COVID-19 infection at all costs. That is not the correct policy. It never really was the policy. The policy is really to consider what the impact of the lockdown, of the actions of the policy are. And we know, for instance, that with schools is really an obvious issue. You cannot shut down schools and then just assume that you're doing something good because there's some infection in the school. We know that there's a significant drop in learning, but also all the socialization that children need, all of the physical activity, all of the health, all of the nutrition. We discovered, there were over 200,000 cases estimated of child abuse that were not picked up because the schools were closed for 2 months. This is really a heinous kind of result. We have to be aware of what's happening. So the governor, you're exactly correct here, is that picking up on a PCR test a piece of virus, which is an RNA virus in this case, does not equate with being contagious. And so we really have to be careful about testing, and I think the CDC guideline now is very clear that asymptomatic people, that's not a priority for a test. CDC is not saying you cannot get a test. They're just saying there's a rationale for getting a test, and if you're concerned, you can contact your doctor or your local health official. But there must be a prioritization because we need to use the testing not to lock down society. We need to have the testing result in something very positive, and that is decreasing deaths. And so we're going to be, we have recommendations coming out on ramping up testing in nursing homes. For instance, when there's a COVID-like illness presenting to the emergency rooms at a higher rate, there may be 2 times a week, 3 times a week of the staff, because the staff, and like the teachers in schools, they are the ones that bring the infection in. And so we have to focus on that. We don't just use testing as a way to detect asymptomatic virus.
I think it also raises the other point about what is the best evidence now about the role that asymptomatic spread plays? Because at the beginning, I remember in January when the news was coming out of China, everyone started focusing on it. I think it was Dr. Anthony Fauci that said there's not been a respiratory virus in history that's ever been driven by asymptomatic spread. Not that it can't happen, but that it's driven by symptomatic people. I think as we were in February, March, that was kind of the view. And then I think that it's kind of shifted to where a lot of the policies, the non-pharmaceutical interventions are really aimed at the idea that the asymptomatic population is really the drivers or major drivers. It seems like some of the studies that have been coming out, when they trace those index cases, they find, yes, there is asymptomatic spread, but most of the spread is done by people who are symptomatic. How do you see kind of the role of asymptomatic spread vis-a-vis symptomatic spread?
Yeah, I agree with Dr. Fauci's statement at the end of January that asymptomatic spread is not the driver of a pandemic. It never was. And it's not in this, but that is true, though, that asymptomatic spread occurs. There's no question about that. So that's very important to understand. However, the number one place for spread is in the home. When you look at where things spread and you look at the contact tracing data from the rest of the world, because we don't have to reinvent the literature, we can use our peer nations' science. For instance, 0.3% of cases arise in the schools, start in the schools. 0.3%. That's August 2nd, Switzerland contact tracing. And this is validated all over the world that most cases are spread inside your home, and they're spread from adults to children, not the other way typically. Of course, it can happen that children spread, but that's not a common direction of spread. And asymptomatic people can spread the disease, there's no question. But there's even data from some of these studies that shows that, for instance, if you have a cough, you're 3 times as likely to spread than if you don't have a cough, even if you're symptomatic otherwise. And this is common sense. You don't have to be a genius to figure out that if someone's coughing up virus, you're going to be spreading. So there's no doubt that the symptomatic super spreaders are the symptomatic people, but asymptomatic spread does occur. However, what you do about that is something else, because again, we have to consider what you're doing. You're locking up healthy, asymptomatic people who are the bulk of the workforce here, and that is really a very harmful policy, and that is an inappropriate policy.
Can you also just talk about, I think you've made the point before about, okay, COVID-19, that doesn't exist in a vacuum. I mean, all the other health problems don't just disappear. And what we saw throughout the country was March, April, a huge decline in ED visits for things like heart and stroke. And it was basically, I think, people were afraid that if they went to the hospital, they were going to catch coronavirus and die, or there was a lot of I think, narratives put out about hospitals being overflowing. And so I think some people just didn't think there was room for them there, so they deferred it. And then what ended up happening is, fast forward 2 months, the patients in the ICU, a lot of them tended to be the people who, had they come in a little earlier, probably would be in a better condition. So can you talk about, just for the general public, the need to be able to go and seek the type of care you need apart from the coronavirus? Because, we're at the point now in Florida, I mean, I think we have about 3,800 individuals who are COVID positive, who are hospitalized, which is obviously very important, and those are all, very important lives, and their health's very important. But, we have 22 million people. We have people that we have all these other ailments, and to lose any more ground on that, that's going to have profound consequences going forward.
Yeah, I mean, this is also very, very important for the public to understand, because there's been a tremendous amount of fear instilled by statements, and particularly by the media, sensationalizing exceptions and things. And I think it's created something that's really harmful to society. I mean, we've talked about this before, but there are 650,000 cancer patients on chemotherapy in the United States today. Half of them didn't come in for their chemo during the first 2 months of the lockdown. 2/3 of cancer screenings didn't get done. More than half of childhood immunizations didn't get done. When people said there were not, we shouldn't do elective procedures, that really was taken to an extreme. 60% of ambulatory care didn't get done. 40% or 50% of acute stroke patients and acute heart attack patients didn't call the ambulance. All of this was from fear. And we have created now a potential public health crisis, really. We had thousands per week of known tumors that didn't get biopsied. So people have to really come in. It's very safe. The hospitals are very aware of what happens now with isolating people who are COVID positive. COVID testing is done. I mean, because of all the testing, we have some distortion of statistics. For instance, in Arizona, although there were a huge number of COVID so-called hospitalizations, it turned out that only 15% roughly of COVID hospitalizations were actually for COVID. They happened to be COVID positive tests, but it was distorted into that's why they were hospitalized, and it really wasn't. So the hospitals, I think, particularly in Florida, and I know some of the many great hospitals and doctors here personally, are very attuned to testing and isolating people who are COVID positive, but you really must come in for your medical care. I mean, at Stanford, my neurosurgery colleagues anecdotally told me during this frenzy that the neurosurgeons themselves were calling up patients at home saying, listen, you have an aneurysm, you have a brain tumor, you have an AVM, a vascular abnormality in your brain, it could rupture and you could die or be paralyzed, please come in. And about 40% of those patients were saying, I'm afraid, I don't want to come in. It's really a tragic result. So again, it points to, we need people, and I see it here, very clearly, who are in leadership positions, who articulate the data, who tell people we know what's going on here. We are very cognizant of we have room in the hospitals, we're protecting the vulnerable, we're going to ramp up the protection of vulnerable, but we need to have people get their medical care.
Great. Janet, can you talk about, are you guys offering a virtual option, or and then if you are, what percentage of parents have chosen virtual versus in person?
So yes, we are offering a virtual option. We did a distance learning survey, and based on those results and conversations with those families, we have about 25–30% of our student body is participating virtually, and the rest are coming in person.
So how have you had to do that? I guess, are you just filming all the classes and then they can log on? So it's pretty much, it's not like a separate lesson, it's the actual lesson that the in-person is getting?
So we have some classrooms that are purely virtual, where the teacher is in an empty classroom and teaching using online platforms. I believe we're using Zoom, which everyone is familiar with. And then in other situations, just depending on trying to meet class size amendment, proper sizing, et cetera, we have some hybrid classrooms. And so we have purchased the technology and signed up with a platform that will allow students who are participating remotely to have a truly in-class experience and be able to raise their hand. And there's a motion camera that tracks the teacher so they can really have a very participatory experience.
Great. And Richard, what's the numbers in terms of the parents? I know it varies by district, but can you give us an overview about percentage of parents who chose in-person from the beginning, and then are they allowed to then, like if a parent chooses virtual, can they then just opt back in, or do they have to do virtual for a specific period of time? And I'm sure that varies by district.
Yeah, and
as well.
it varies by district, but generally speaking, if a child who's started virtual, but now, the parents have decided they would like them to be back into face-to-face, most of our districts are complying with the 100% of the requests. They might just have a lag time. They might say, okay, you can come back in a week or two. But statewide, and we'll get final numbers by the end of the week because we had another 18 districts that started this week. But we'll probably be just under 60% are in face-to-face and 40% are in virtual or hybrid.
Great. And
that's 1.6 million students of our 2.8.
Are in person?
Yes.
Yeah. Michelle, can you just talk about what it's been like for families, just with your kids, and then maybe people that you know, either here or in other parts of Florida?
So I will tell you, my sister is actually a proud public school teacher in Hillsborough County, and she has an autoimmune disorder. She has rheumatoid arthritis, and so for her, she chose to stay and do virtual. So she is doing 100% virtual. And it's just interesting having two sisters that have very different needs, and we have the flexibility to both be able to thrive and function moving forward in this new environment. To my own personal family, I will tell you, I cannot speak enough about the value of children being able to be back in the classroom. Emotionally, physically, there are just so many benefits that I see every day. So again, having that flexibility is just really key, I think, to thriving in this environment that we're in.
What, like your kids and other kids that you may observe, like over the summer, I mean, they were engaging in activities and doing normal things, or were they all kind of cooped up for the summer?
Yeah, so my husband and I, we both work, and it was interesting. My husband is what's classified as essential business category. So every day he was able to go to work outside the home. And so I, in effect, became the stay-at-home, work-from-home parent. And I will tell you, the children, of course, many things were limited. Summer camps were canceled. Options were very few. However, where possible, I think continuing to stay active and be able to have some kind of normalcy over the summer was really key.
What we had in most parts of the state, they were doing youth sports over the summer.
Yeah, I'd say there was availability of youth sports and summer camps. Summer school was limited, but over a majority of the districts had it. But almost all the districts had some sort of after-school, preschool programs, camps available up and down the state.
But then just aside from the school districts, just things like, I mean, people were playing like lacrosse,
Correct.
baseball, all that stuff, right?
AAU, basketball, all of that was going on.
Yep.
And even summer football.
Yeah. Dr. Rivkees, you're on the long-term care task force about reuniting people with their loved ones. Can you just give us an update? I know you guys submitted a report that we're reviewing, but can you just fill everyone in on the issues you considered and some of the recommendations?
Yeah, thank you. You know, a really important issue, as loved ones haven't seen individuals in long-term care facilities for months. So we talked about a few major things. First, how do we allow general visitation? And this can be done safely with individuals, designated number of individuals who will be allowed to visit, potentially two visitors at a time, individuals having distancing and wearing masks, and preferably outdoors, but because we know this virus is much less transmissible outdoors than indoors. Then also for individuals, essential care providers, individuals who provide help bathing, feeding, emotional support. So I was really proud to be a member of this panel led by Secretary Mayhew, who's in the process of providing you some specific recommendations.
Great. Yeah. I mean, we prohibited visitation middle of March, and then prohibited hospitals from discharging a COVID-positive patient back into those nursing homes. And we obviously were concerned about spread in those most vulnerable areas. And so it was something that we felt we had to do, but we understood that that's not something you take lightly. We were always, as we kind of got through the first 6-8 weeks, March, April into May, we started to think about, okay, what would be the next step on this? And then as we started to deal with this Sunbelt surge, we're like, all right, well, we need to plan. Obviously, we got to get on the other side of this. And so we had it's a great story. There's a lady in Northeast Florida named Mary Daniel, and her husband's in a memory care facility. And so she wasn't able to see him. And rather than kind of just, hope that policy would change, although she's been a great advocate for policy and she's on the task force, she actually got a job at the facility and so that she could go in and see her husband. But it just brings to mind that, okay, we obviously want to prevent this virus from getting in there in those facilities. But at the same time, you have a lot of people, and we have over 4,000 facilities. You have people who, we have a lot of facilities haven't had one single infection. You have people that have serious illnesses apart from this who may not have a lot of time remaining, and they weren't able to have their loved ones have that interaction. And so we view that as a tremendous emotional cost. We view that as a tremendous cost. And so basically, we have Mary, Dr. Rivkees, we have Mary Mayhew, who's our Health Administration Secretary. We've got some other folks from some of the relevant associations that we said, we need a way forward. We need a way forward to be able to reunite people, and not just being able to show up at a window and wave, but being able to actually go and have people be reunited. And we're also encouraging now, that the nursing home long-term care was our policy to restrict that. We did not issue any policies with hospitals, but I think, as you know, hospitals did not have visitation early on, and that was understandable. What we've now seen is, at least in end-of-life decisions, I think most of the hospitals are allowing family members, but I think our perspective from the state is, if somebody is ill, their family members should be able to go in and be with them. I mean, we have enough procedures, enough mitigation in place where I think that can be done safely. And so I would ask any hospital, do what you can to allow those family members to come, not just for end of life, but I mean, if someone ends up in a car accident and they're there, being lonely and being alone and not having the family, that's a really, really tough blow, of course, for the person who's suffering, but it's also oftentimes just as agonizing for the family, because they want to be there and they want to provide that comfort. So we're going to be announcing the changes with the long-term care facility very soon, and obviously we are encouraging the hospitals to let families be there for that. Do you have any final thoughts about where we are? I mean, obviously we've been focusing on schools. I know you guys on the task force are looking at some other things. Some of the things that I've been interested in is, we've had there's travel restrictions from Europe, Brazil, and all that. I look at Europe, I see an epidemic that's waned there. Is there thought about maybe going in a different direction there? And anything else that you think may be pertinent?
Sure. Yeah, well, a couple things to add to the nursing home thing. First is that this is a very important issue that has sort of been put in the back burner as visiting people. The average stay in a nursing home is something like 6 months. And so normally, and you have 1.5 million people in the United States in nursing homes, it's tragic when they cannot see their families. And I've heard also personal stories about this. So this is critical, and it's being looked at by the administration and by CMS, the Centers for Medicare and Medicaid, Seema Verma in charge of that, as we're very aware of this, and we're going to try to come out with some solutions as guidelines. The other issues, the transportation, of course, I mean, most of the world's economies depend on transportation and tourism and things. This is a huge issue for economic recovery. A lot of these businesses are hurting, and I think everyone's trying to put their heads together and figure out how to deal with restrictions or non-restrictions as these things are waning in most of the world, and actually in most of the United States to a great extent. And I think we have reasons for optimism for that. Not only are the infections coming down and the deaths coming down in a lot of the places that were the hardest hit in the U.S., East Coast and the South now. I also think, just to point out, we're doing much better with treating patients. You know, hospital lengths of stay are 1/3 what they were at the peak. Mortality in the hospital, if you're admitted, is about 1/2 what it was at the peak. Need for an ICU is less. Need for a ventilator is less. So I think we have to be, the American public should feel cautiously optimistic here about what's going on. There is no need for fear at this point. And then one other issue to bring up before I run out of time is, you mentioned, because I know FSU just opened up, I was told, and I happen to be I'm a Big Ten football and basketball fan. I hate to say it, but anyway, because I went to University of Illinois for college, which isn't a great sports school, but basketball, we're going to be good this year. And it's very important, actually, and I think underrated in its importance, the idea of opening things like college football. There's sort of, again, this misplaced emphasis on positive testing and things that we're talking about. Athletes here, I mean, they are among the most fit people in the universe. They're very low-risk people. These are the communities of college towns depend on these activities. As we know, businesses in Palo Alto, I mean, there's an estimate that half of the small businesses will go out of business and not return because Stanford's sort of closed down. And, you know, also we can protect the vulnerable. These are settings, pro athletes, if you've ever been in a locker room or in these colleges, I mean, they have a very, very controlled environment. They have testing, they have doctors. This is the best possible healthy environment for the healthiest people. And so to start saying that we can't have these sports when so many people in the community also depend upon it, the athletes themselves, their families, this shouldn't really be a point of controversy. The football, college football should be opened. It can be done safely. We can have social distancing in the stadiums. Obviously, these are huge stadiums. There's plenty of room for people to spread out. We can protect the high-risk family members who might go. But I think college sports is a big part of America, and it's a big part of the economic engine, and it's a big part of people's individual and families' dreams for their future, and that really should be revisited.
Well, the Big Ten made a decision based on some heart, like the heart study that has really been shown to be not worth very much.
Yeah, I mean, this idea, again, this is an example of sort of what I call maybe sloppy thinking about what the studies actually show. And because of the fear overlay, I mean, the myocarditis picture, I'm not going to bore you with the details, but this is an MRI finding. It's an abnormality on MRI in a very exquisite, sensitive study using MRI. It's people who are middle-aged or people who have died. There are some people, one study was done in people who have recovered, and another study was just simply in people who have died. They have an MRI finding of the study of people who were middle-aged who had the finding. There's no necessary correlate clinically to this finding. It's not clear that there's a serious, functional abnormality there, and we're not talking about 20-year-old college football players here. And so, it's just a very different population. We got to be careful what we infer from some of these papers that are published, and I think I hope that the people who are in charge of college sports really look at this. I mean, I know there was a cardiologist from Mayo Clinic the other day who said, this is absurd to close college football for that. And I think it's very important to really think through what we're doing and use critical thinking before we make a policy decision.
When they had the so there was, I think it was when we got the beginning of August, there was all this scuttlebutt about the college football season's about to go away. The Big Ten was leading the charge. Pac-12, I don't know when we'll be able to see a Pac-12 game, maybe in like 5 years. I mean, but so they obviously were going to be out of play. I think everyone knew that. And, to the credit of the folks here, President Thrasher, folks at UF, we were very supportive of you guys should be playing. Look, if an athlete doesn't want to play, let them keep their scholarship, let them have another year of eligibility. No one should be forced to be playing, and you should not suffer any negative in terms of scholarship or any of that. But these are kids that have worked their whole lives for this. And to take that away when it doesn't need to be taken away was a huge, huge mistake that the Big Ten made. And I think if they don't play, all of those kids should be able to transfer someplace that's going to let them play. They went in there under the understanding that they were going to be able to play. They have some of the best players in the country in that league. Not as SEC is the top, but it is what it is. So, but I just want people to know, I've spoken with the executive director of the college football playoff. We're hosting it in Miami in January. It's going to happen. We look forward to doing that. It'll obviously be an SEC school, maybe 2 SEC schools. Who knows? Maybe Clemson, an SEC school. So we know. So like the Pac-12 not being involved, I don't know. Ohio State, I think, would have had a good shot, and they should be able to play. But we're going to do that, and we're also having pro football. I was with the Miami Dolphins. They have a limited capacity stadium plan. They're executing that. Jacksonville's going to do the same thing, and we believe the Tampa Bay Buccaneers will do the same. And then so is Florida State and our colleges. They're going to have fans on a limited basis. I fail to see. Some people say you could have 50,000 people protesting, and that's fine, but you can't have a half-filled football stadium. Of course, you can do that, and so we're going to do that. And I think it'll make a big difference for. Look, it's a big part of our culture here in Florida and Southeast in particular. But really, it's just about the athletes. I mean, you don't get this opportunity again. You're not going to be able to just rewind. You're not going to be able to punt the season to the fall, to the spring. That's not how football works. And my only regret is that the NCAA suspended the rest of the fall sports. I mean, you actually have these athletes. They're training. They're doing the same things they would be doing, but they're just not allowed to play in there. So they weren't able to do that with football because it's not controlled by the NCAA. So but we look forward to hosting that game, and we look forward to hosting the Super Bowl in Tampa in February. So it's going to be interesting.